I've been doing PEMF, I think, for at least 3, if not 4 years. I have my patients who get ozone therapy into joints. I like almost all of them to receive PEMF. I know that it helped me because I had a degenerating cartilage in my left knee, and I had stem cell injection into my knee and PRP, platelet-rich plasma, and it made me sicker than crap for a couple days, but I got better, and that gave me about a 60% relief. Then I started shooting ozone into my knee, and I did PEMF, and that finished it off, and now I don't even know that I have a knee, which is really nice, because my knee was clunking really bad before. And we do it on joints. We do it, I have patients who get IV therapy sit on the mattress. If I do ozone injections, I ask them to go in and treat the joint that's involved and generally treat themselves on the mattress too. They're usually on it for 10 to 15 minutes. And some people will come back on their own because they learned how to do the machine, and they'll just come back and treat themselves. I like the machine. As I said, there's no one size that fits all for anything, but as part of an overall program to stimulate healing, I like it. And my dad, this was interesting. This is a true story. He said, he'll buy the machine if I could guarantee that I could get rid of it for him for what he paid for it. I said, I'll guarantee it. I'll personally guarantee it. Because at the time, I got him a really good price, and I knew that I could match it out in the field. 6, 8 months later, he calls me up and he says, I'm ready to get rid of the machine. Can you get rid of it for me? I said, I think I can. Within a week or two, I had a buyer, very eager buyer actually, called up my dad and he said, I changed my mind, I don't want to sell it. Evidently, he was helping my mother's low back, and he was using it for his pelvics and urination, and it was helping him. And then when I go visit them in Florida, they're well into their 90s now, I show them how to do different things with it, and they're using it, and they seem to like it. They're old, and it's energy, and it's non-invasive, which is really nice. I got into things that try to help the person heal, which is oxygen-based medicine. You get more oxygen into the system, you encourage the cells to heal. If you can stimulate the cells, and I considered PEMF, after I read about it, to be basically a massage of the cellular membrane. Gary Gordon calls it MICE, magnetically influenced cellular exercise. I think it's a cellular membrane massage. That's what I think. And if you make the cell membrane more fluid, more active, because that's where the action is, you get better nutrient passage, and you'll get faster healing. And that's pretty much what I'm seeing. I've seen people, I'll give you an example. On an unusual occasion, but it happens, all of us get phlebitis in our patients from IVs. I mean, it doesn't happen often, but sometimes somebody will get an irritation in the vein from an IV. First thing I do is have them go to the PEMF machine. And it only happens every many months, but they get better very quickly from it, much quicker than they would have gotten otherwise.